There's 2 trailers of that film. We welcome a new member, Dr. Chris Meyer. He is a Family Eye Care of Newburgh. Doctor, welcome. Good to have you. Tell us about Family Eye Care. Also, you're a native of Owensboro, right?
Owensboro native, yeah.
Good for you. Now, that's where Family Eye Care, I guess, originated? Or it's the main office?
Yeah, we have a main office in Owensboro. It's Owensboro Family Eye Care. And over the years, they've done so great. They've expanded a ton over there, and we're looking to expand into a new market. And Newburgh just made sense, so we opened up our doors in November of last year.
Where exactly are you located, Doctor, in
we're on
Newburgh?
Peachwood Drive, which if you're on the Lloyd, you turn onto 261, which is the highway that takes you by all the Castle schools. Peachwood is that first stop sign or stoplight you get to after you turn on to 261. We're right around the corner.
Got it. It's a good landmark, isn't that a good point?
Absolutely.
Let's talk about, back to school. Why are back-to-school exams, we take them for granted, are they really important?
They really are important. In fact, in Kentucky, they're a state law to have an eye exam before you initiate preschool or kindergarten. I feel like it is that important. A lot of times, especially the younger kids, they don't necessarily know that their vision is blurry. Or a lot of times, maybe they're even too young to verbalize that they have blurry vision or eye problems. So really, a lot of times, the only way to know is to have them come in for an eye exam and get a good checkup.
How young might a child have an eye problem?
Well, we can actually see kids as young as 6 months, believe it or not. But at least the recommendation is probably around age 3, around whenever they're going to start preschool, learning their ABCs and 1, 2, 3s. It would be a good idea just to get the eyes checked to know that they are able to see those.
And also, if you get it early enough, the results can be very favorable, can they not?
Absolutely. If undetected, some of these problems that we're detecting can cause permanent vision loss. If we detect these at an earlier stage, we can either through corrective lenses or other procedures, we can maximize the vision potential for the rest of that person's life.
Now, we just saw some nice video of your office. There's a fear sometimes of just like going to the dentist, but coming to get your eyes checked. Walk us through what, as a specialist, Christopher, what are you looking for with just the general regular exam?
Well, keeping with the theme of back-to-school eye exams, especially the little kids, we try to make it a more positive, enjoyable experience. A lot of times the dilation drops, the dreaded air puff test, can kind of be scary. So we have some equipment. It's called the OptiMap retinal scan. It actually takes photos of the back of your eyes. So for routine cases, we wouldn't have to dilate eyes. We also have some other instrumentation to avoid that air puff, but still get the information we need. And we just have the latest technologies just to make sure that our findings are accurate and leave you with the best vision possible.
Again, talking with Dr. Christopher Meyer. He runs Family Eye Care of Newburgh. And we're coming back to talk to the doctor in just a moment. Stay with us.